After the surgery of your low back for your disc herniation, you'll be admitted to the hospital. Specifically trained nurses will be assessing not only your vital signs, but also your neurologic status in your legs. They'll be looking for other signs and symptoms of dangerous things to alert me if anything bad happens. By and large, that doesn't happen, but better safe than sorry. You'll be eating as soon as you can, and you'll be walking almost immediately. Certainly within an hour, you will have already walked around the ward. It's important that you do that because it diminishes blood clots in your legs and it helps your lungs. Other things that you can do for that is to breathe deeply. I'll want you to breathe about every 15 or 20 minutes, a great big deep breath. What that looks like is something like this, just a simple deep breath. And you hold it and then you slowly let it go. Do one of those about every 15 or 20 minutes and that'll prevent post-op pneumonia problems. Walking will prevent blood clots in your legs. That evening, I will come by on evening rounds and discuss your discharge instructions. And I'll go over your wound care, your follow-up, your medications, and your activity restrictions. While you're in the hospital, we'll discuss your lumbar brace and exactly how I want you to use it. You won't need to wear it all the time, and in fact, you'll only really wear it when you're up walking around. You don't have to wear it while in bed. You don't have to wear it doing simple activities. And we'll wean you off that in a fairly short period of time, probably 4 to 6 weeks. Your follow-up appointment is generally in 1 month. Obviously, if there's some problem in that intervening month, just call the office and we'll get you in earlier. Regarding wound care, your wound was closed in multiple layers. There's usually 2 or 3 layers below the skin of stitches that will dissolve on their own. And finally, a plastic surgical closure. On top of that is a material that looks almost like super glue because it helps glue the wound together, and then a very simple dressing. The dressing that's on there is waterproof, and you can take a shower the day of your surgery. After your shower, I'll want someone to take a look at the wound and make sure that it's dry. If it looks like the wound got wet, then you need to change the dressing. Generally speaking, we can get you through 4 or 5 days without changing the dressing, and then you can take it off and get it wet. And from then on, every time you get it wet, just make sure it's dry by blotting it dry and follow it up maybe with a blow dryer to get it nice and dry. Any concerns about the wound that you might have are also concerns that I have. So if you're concerned, give me a call. What we're looking for are signs of an infection, advancing red zone, any pus, really anything. If you're concerned, let me know. So by the time that I've gone over all of these discharge instructions, you should have a very strong feeling for what's coming. You should have a good idea about your wound care, your follow-up, your medications, and activity restrictions. The post-op care is much simpler than most people think, and they do very well at home. You're going to do great. You just follow these various guidelines, and I'll take care of the rest.